Hi, this is Dr. Sellers at Dr. Sellers Educate. Thank you for joining me. This is a snapshot of CNE Review Competency 5. Course objectives, you can see here on your screen. For those of you who've joined me for Competency 1 through 4 snapshot, you know about your homework, so hopefully you were able to get that completed. We are using Linda Caputi's 2019 CNE Review Book as a reference for our session. As a refresher, Competency 1, facilitate learning. These are key concepts that you need to make sure you cover as you get ready for your CNE exam. Ensuring that you review content related to the evidence-based practices for teaching, as well as modifying teaching strategies and learning strategies based on cultural background, the setting, the learning preferences of students, and the method of delivery. Competency 2, facilitate learner development and socialization. There are a couple of learning styles that we've talked about, but in your review book, you want to make sure you review all of them. It's important to identify the needs of diverse student body and to ensure that you understand what your teaching strategies would be as it relates to each of these different types of student groups. Students with previous education as well as experience, such as the accelerated student, as well as the social cognitive theory of learning, they highlight the importance of ensuring that we modify our teaching strategies to support the learner. So make sure you take a look at that. At-risk students, students with disabilities, we want to make sure our learning and socialization that occurs in the classroom, that it's fair and that we are incorporating them into what we do. All right, moving on to the 3 domains of learning. There are 3 that we have talked about, so make sure that you take some time to look at how each domain relates to the development levels and, most importantly, to the engagement strategies and to activities in the classroom so we can engage our students at the highest level learning possible. All right, practice question. What is the most important strategy for the nurse educator to implement when preparing to teach a group of adult learners? Go ahead and pause right here. The answer is A. Adult learners expand on their previous experiences and learning when learning new material. Next practice question. Which learning outcome represents the highest achievement in the cognitive domain, which again is the which level? You got it right. It is the highest level of learning. Go ahead and pause. The answer is D. D is correct as it requires knowledge synthesis to create a plan of care that did not previously exist. Moving on as part of our refresher to competency 3, use assessment and evaluation strategies. Ensure that you are clear about the admission, progression, and graduation requirements as it relates to NLN guidelines for this competency, what should be included in each of those areas, how we should use assessment and evaluation data to enhance the teacher learning experience, and the difference between assessment and measures. The assessment cycle, figure 3.1, this is from your the second edition of Linda Caputi's CNE Review Book, which I consider the Bible when it comes to how to prepare for the CNE. If you want to be successful the first time, I would say you need to invest in her 2 things, her book, and make sure that you commit to reviewing these snapshots and reach out to me if you need additional support. Exam analysis. These are key concepts that you need to make sure you understand. Here's a practice question. A nurse faculty member on a clinical unit notices that the students are not correctly documenting their patient's vital signs. He develops a short exercise to be used in that day's post-conference to practice vital sign documentation. What type of assessment is this? Go ahead and pause to answer the question. You are correct. D, formative assessment occurs during the assessment period and supports modification of instruction. Second practice question. If you want to go ahead and pause the video. The answer is D. A p-value of less than 0.70 indicates more difficult items, and a low KR20 shows poor reliability, and it should be greater than 0.6. Competency 4, refresher. You want to make sure that you understand how each of these concepts influence and are part of the curriculum development process. So the program outcomes, competency statements, course objectives, learning activities, clinical experiences, and evaluation strategies. We must actively participate in the design of the curriculum as faculty. When we deliver the curriculum, there are two important factors you want to consider: the content that's taught, as well as characteristics of those students. The process for measuring student learning related to course student learning outcomes. There's a process and a sequence that we should follow as depicted in figure 4.1. Practice question. If you want to go ahead and pause the video. The correct answer is A. The first step in developing a curriculum is to determine the desired characteristics of the new graduates. All right, here we are, Competency 5. Finally, right? That was a long review of 1 through 4. So just to set the stage, Competency 5 shows us and really describes for us how we should conduct our self-evaluation and how we improve as a nurse, as an academic nurse educator. We must be multidimensional, and we should receive feedback from multiple sources that we'll talk about. And our goal is to maintain competence as a clinician, educator, and scholar. That requires ongoing quality improvement. Theories, evidence, and tools. We should be looking at research and evidence and the best evidence to determine what our quality improvement initiative and goals are going to be. Boyer's scholarship of teaching identifies what we should do as it relates to how we teach and how we prioritize our development opportunities. Donovan SPO, which is structured process outcomes, is a model that we should look at as we think about mapping out our teaching as well as our career plans. Knowles is an adult education model. So make sure you take some time to look at key concepts associated with that model as it relates to guiding our teaching and learning practice. QI approaches. There are 4 common areas that we can benefit from when it comes to QI. Engaging in activities that promotes one's socialization. It's all about fit when we think about the academic institution that we choose. There's a transition that happens. So be mindful of the varied roles and activities and the leadership within the university to support your success. Role socialization. Make sure you understand who your mentor is going to be, who your preceptor is going to be, and the support that you'll have to get acclimated to the role. You want to make sure that you maintain your membership in your professional organizations as well as in the clinical setting. Okay, so make sure you stay connected to what's going on and the trends that are happening in those 2 environments. Lifelong learning is what we do, right? That's why you're here, and I'm so glad that you joined me for Competency 5. Benner is an important theorist to remember, as well as the theory of constructivism when we talk about lifelong learning. Professional development is just part of our journey as we strive to be stronger educators and to better support our students. Teaching, scholarship, and service must be balanced to ensure that we are a well-rounded educator and really role model for our peers and to best support our community of learners as well as our nursing community overall. Feedback is critical from ourselves, so doing that self-reflection, the self-evaluation of where we are on our journey to becoming an even stronger educator. Peer feedback, our student or learner feedback, as well as administrative feedback is all important to help shape us and form us to be a stronger nurse educator. The triangulation method allows us to receive feedback from all different sources. Student ratings of teaching is feedback, but it's only one component of feedback, but it is very important feedback. Practice question. If you'll go ahead and pause to answer the question. The correct answer is D. Commitment to building a career to one's personal life and responsibilities typically need to be balanced. So it's all about balance. We want to practice according to legal and ethical standards relevant to higher education and nursing education. So there's no new information here, ensuring that we're following ethical and legal principles, and that that information is included in resources and handbooks that are provided to students as well as faculty. Mentoring is needed by all faculty, but most importantly, identifying that mentor that's going to be a great fit for you as you transition into faculty role. You all know I'm all about self-reflection. I believe it is a core concept, just as NLN does, as we strive to be stronger educators and stronger clinicians, and to support others in their work that they're doing in the academic space. Self-reflection keeps the nurse educator focused on the most important aspect, which is improving our teaching practices. Boyer's Scholarship of Teaching and Learning model also supports the value of self-reflection. All right, that's it for Competency 5. I am Dr. Sellers Educate. Here's my contact information, and I hope to see you back here, either on my YouTube channel or whatever resource you use to stream our time together. Bye for now.